Hi everyone, my name is Dr. Francis Vala, the author of The Third Vision, The Science of Personal Transformation. My dream is to help people be empowered and transformed so that they can achieve their highest levels of potentials in one or more of the four foundations of life: the body, the mind, the soul, and social aspects. And I'll be focusing on the mind today. I hope you enjoyed my first video, which was about how to prevent addictions and substance abuse. And today I'm going to be talking about the mind and its relationship with weight problems. I want to thank you all for posting your questions and comments and sharing with your friends and network. And one of the questions that was raised several times was, what is the relationship with the mind and obesity, overweightness, and other weight-related problems? And is there any connection or not? And I want to share that with you today. Have you or any of your loved ones ever suffered from obesity, overweightness, and related mental problems? Let me share a story, a true story actually of one of my patients. Let's say her name was Tina. And this is actually a true story, and how she was suffering from some mental issues, and we're going to get down to what the connection of the mind and the body is. So Tina was a 32-year-old girl, and she was in my practice for over 2 years, and obviously she was obese, but it was sensitive, and I didn't feel comfortable to raise the issue of weight with her until whenever she was ready. She had other issues, obviously, and she saw me several times. So finally, after a couple of years, she brought it up. Said, Dr. Vala, I understand you deal with weight problems, and I was wondering if you could help me. And so we opened the conversation. Said, what is the problem? What's going on? And Tina said, well, you know, to be honest, I've tried several different weight loss programs, and I am able to lose the weight. However, here's my challenge. And every time I lose weight, once I become noticeable and people notice me and give compliments and comments about it, that freaks me out. And as soon as I feel that, as soon as I get compliments from people, I get anxious and start overeating and binge eating again. And hence regain the weight. And this has been my challenge for several years, and I've been struggling with it. So anyways, we had a long discussion, and we did a lot of counseling, and I was able to help her out. But the question is, what does the mind have to do with obesity, and how does it affect your weight gain? So today I'm going to get a little bit into the science behind it, and share a conceptual and tactical approach of the relationship between the mind and obesity or overweightness. First, I'm going to explain a little bit about the background science, and then share with you some tactical approaches of how you can help yourself or one of your loved ones, how you can help them self-manage and understand what the relationship is. So if you watch my first video, we did talk about the TFA, or the thoughts, feelings, and actions triangle. So if you recall, we had a discussion that the TFA work very closely together. The thoughts affect the feelings and actions. So positive thoughts can lead to positive feelings and positive actions, and inversely, negative thoughts can lead to negative feelings, negative actions. So these three arms, if you remember, had a very close relationship together. So what that means, anytime you have, so we could have, let's say, positive feelings or negative feelings. So anytime there is a distress, generally by default, we tend to avoid that distress, avoid that negative feeling. And it's oftentimes very difficult to directly change that. So what we do, we tend to indirectly change one of the other two arms. So either a lot of people may use their thoughts negatively or positively, or they may use their actions negatively or positively. So, in other words, a lot of people, when they get distressed and they want to avoid that emotional or physical pain, what they do, they take actions which may be destructive. And what happens is most people show destructive actions, destructive behaviors to compensate for that. So these are coping mechanisms, defense mechanisms to avoid that pain. There's constructive actions, such as exercising, playing the music, running, socializing, journaling. And there's destructive coping mechanisms, such as alcohol, drugs, which was a discussion last time, and binge eating is also one of those destructive actions and behaviors which can lead to a number of problems, including obesity and overweightness. So similarly, some other people may use negative thoughts or destructive thoughts or positive thoughts and constructive ones. But today, again, most of the work is going to be, discussion is going to be around binge eating and overeating as a defense mechanism to compensate for the distress. So let's go back to Tina. So upon further discussion and history taking, I became aware that she suffered a history of sexual abuse. So this is what happened. And so anyways, we had a long discussion. We went back to try to understand what went on. And so as in her childhood, she experienced sexual abuse, unfortunately. And as a defense mechanism, subconsciously, what had happened was that she had used binge eating and overeating as a defense mechanism. So she realized, and a lot of this was her own awareness and self-awareness, and she actually reflected to me that, you know what, Dr. Vala, I actually feel safer when I'm overweight, I'm obese, because I don't get that much attention. And she realized that she had been using this mechanism subconsciously to become obese, to not get the attention that she would if she was thinner, and this way she was feeling safe inside her larger body. That's her own reflection and her own understanding of what was going on in the body. So basically what was happening is that she was using overeating and binge eating as a defense mechanism, likely because of her sexual abuse, to protect her. So she felt protected and safe in her larger body. So as soon as she, on the other hand, consciously, she wanted to lose that weight, she wasn't happy with it, so as soon as she would start getting on a program and starting to lose weight, then she would lose the weight, she would become more attractive and more noticeable, hence the compliments, which would freak her out again, and as a result, this catch-22, this vicious cycle would go on and on. You follow me? So this is what was going on in her body and mind, and that's how the mind works constantly, and most of this is done subconsciously, so we're often not aware that our brain and the mind is doing this to us. So this was a very simple, again, conceptual approach of what the relationship is. And this triangle, I will be referring a lot to this core fundamental triangle because it explains many different mental illnesses and sometimes physical illnesses as well. So how about a tactical approach? So what do we do about this? So how can I or a physician or somebody help the patient or the patient help herself? So we had a long discussion and I explained to Tina that, look, we have to address the mental issues first before we could start any weight loss program, any medications, any diets, because it's never going to succeed. If she does not have the understanding of what's happening in the background in the subconscious mind, yes, she could have a temporary success and lose some weight, but she's going to regain it because of the mechanism that we explained. And it's not going to be sustainable, it's not going to be successful. So in these scenarios, oftentimes we do have to address the mental issues first. And so basically, I referred her to some other resources for further ongoing counseling, CBT or cognitive behavioral therapy, and some other psychotherapy techniques to help her out. And once she was able to understand those issues that was going on in her mind, then we were able to help her with her weight. What I would like to do is share some of the physiological aspects of what happens in obesity and what goes on at a cellular level. What I shared with you, the binge eating and the subconscious thought, that's a mental aspect and the mental reasons for obesity. But there's also some physiological levels and things that happen at the cellular level as well. So every time you get distressed, what happens is that a number of hormones and substances are released in your body. For example, one of the things that's released is cortisol from the adrenal glands. Another thing is called ACTH, which is released from the pituitary gland. And what they do, basically, they increase your hunger level. They increase your insulin level. So insulin, as you know, is a hormone that's secreted by your pancreas. And insulin's job is to store energy and store the fat. So insulin does not allow the fat cells to break down, and it causes the fat to accumulate. Another thing that we know happens is the VAT, or visceral adipose tissue, increases. The visceral adipose tissue is the specific type of fat that's inside the abdomen, around the organs, around your stomach, liver, the intestines, and there are mainly 4 main types of fat in the body. The VAT, or the visceral adipose tissue, is the most dangerous one, the most metabolically active, and it's the one that's directly related to cardiovascular disease. So as you can see, obesity and stress basically has several mechanisms that can be damaging. All right? So we talked about some of the conceptual approaches, the mental aspects, the mental relationship of the mind and obesity, and as well as the physiological aspects. So how about tactical approaches? So what? What can you do for yourself? So let's go back to the formula for change. If you recall from the first video, we talked about the formula for change. Anytime you want to make a change in anything in your life, remember this simple formula, KPT. So you need to know the knowledge, you need to know what to do to change, you need to know the practical tools and practice it, and you need to give it time. So if we want to make a change, for example, in obesity, in our thoughts and behaviors, we need to have some knowledge and understanding of what's going on. Why are we obese? Why are we gaining weight? Why are we having difficulty losing weight? And what is the association or relationship with the mind and obesity, which I just explained in very simple terms. The other thing we need to do is some practical tools, simple tools that are useful for self-management, and practice it over time. So these are the simple techniques that I would recommend. Again, if you recall, similarly, we talked about 3 simple tools last time. ORS, O stands for observation. So to observe patterns. So once you have the knowledge and you have an understanding of what's going on in your mind, why is it that every time I get distressed, I tend to go to the fridge and start eating? So you observe your own patterns, you observe your thoughts, you observe your behaviors, and you catch yourself. I'm doing it again. You see, I got distressed and I started binge eating again. There seems to be a common pattern. So you start observing. The second thing you need to do is resist. So resisting the urge, the craving when this happens. Again, if you recall, we talked about the brain neuronal network last time, and how it is simpler in the early stages before you have developed a solid pattern in the brain, how much easier it is to resist those urges. But the thing is, oftentimes when people don't know what's going on in their mind and body, it's often too late and it becomes very difficult to resist. If you are aware, if you have the knowledge of what's going on, and if you're able to observe and catch yourself, catch those red flags that are happening in you, then it's easier to resist. But resistance alone usually is not sufficient, because you need to have something else. You need to substitute the defense mechanism that you're using. So talking about the binge eating as one of the causes and reasons for obesity and weight gain, how can you help yourself resist that? And also you need to substitute it with something else. Again, we talked last time about constructive defense mechanisms versus destructive one. You need something. You will be distressed. I mean, stress is part of a normal life. So how are you going to cope with that distress or stress? So if you don't have a constructive defense mechanism, you will resort to a destructive one. And you don't want to substitute a destructive mechanism such as binge eating with another destructive one such as drugs and alcohol. You want to replace it with a positive or constructive action such as exercise, such as journaling, such as playing the music, such as going out, picking up the phone and socializing, talking to your friend, or a constructive thought, a positive thoughts, which there are techniques, there are ways that you can start self-talk, self-positive talk, and this is what most counselors and what we do in counseling and psychotherapy. So one of the techniques, there are so many different psychotherapy techniques. For example, cognitive therapy is one of the things that we're talking about. How to treat the cognitions, how to replace those negative thoughts, the urges, the binge eating and all that, how to replace that with positive ones. So that comes as cognitive therapy. Another technique is behavioral therapy, or BT. How do we change behaviors? Another technique is CBT, or cognitive and behavioral therapy. So there are so many different techniques that is used all around the world in psychology, in psychotherapy. Most of that is based on simple universal fundamentals that I just explained to you. So that's it for today, but I do have a surprise for you. Stay tuned. You will receive another video in a few days, especially those of you who have children. I have a feeling you're going to like it. I hope I've served you. Fulfill and live your ultimate potentials with love, passion, and purpose. Until then, so long.